You fed your baby, burped them, changed them, and rocked them gently to sleep. But 20 minutes later, they're squirming, crying, and arching their back like something's wrong. You try again, feeding, rocking, pacing. Nothing seems to work, and you're left wondering, is it me? Did I do something wrong? Why won't my baby settle? Here's the truth. In so many cases, the issue isn't you, it's their tummy. Digestive issues are one of the biggest causes of fussiness in babies, and yet they're often misunderstood or missed altogether. That's why in this video, we're unpacking the 8 most common digestive issues that trip up even the most loving and attentive parents. We'll cover how to spot the signs early, what's normal, what's not, and what you can actually do to help your baby feel better. And stick around, because the third issue is one that's often misdiagnosed as something else entirely, and knowing the difference can spare you a whole lot of sleepless nights. Let's jump in. Let's start with something nearly every baby struggles with at some point: gas. Gas pain is so common it almost feels like a rite of passage, but that doesn't make it any easier when it's your baby lying there red-faced and screaming. You might see them arching their back, clenching their fists, pulling their legs up to their belly, or just seeming generally uncomfortable, especially after a feeding or in the middle of the night. The thing is, gas is natural. Babies swallow air all the time, while feeding, crying, yawning, and even just breathing. But their digestive system's brand new. Their muscles are still learning how to push air and food through smoothly. So what's a quick burp for us can turn into hours of fussing for them. But here's the good news: you can help. Start by slowing down feedings if your baby tends to gulp. Try paced bottle feeding or switch to a slower flow nipple. If you're breastfeeding, check their latch to make sure they're not swallowing excess air. And burping? Don't wait until the end of the feeding. Burp halfway through and again at the end. Some babies need even more frequent breaks. Positions matter too. The over-the-shoulder burp hold works for some, but for others, sitting your baby upright on your lap and gently rubbing their back can be more effective. You can also try bicycle legs. Lay them on their back and gently move their legs like they're pedaling. Or massage their tummy in small clockwise circles. These simple movements help release trapped gas and get things moving. The key is consistency. Make gas relief part of your daily routine, not just a last resort when the crying starts. And remember, if your baby is gassy but otherwise gaining weight, feeding well, and sleeping in stretches, it's likely just a developmental phase, one that will pass. Next up, reflux, also known as spit up, and something that surprises almost every parent with just how frequent and messy it can be. Now here's the part many people overlook: reflux isn't always obvious. We tend to associate it with those classic moments, the milk dribbling down the chin, the onesie soaked halfway through. But there's also something called silent reflux, and it's a lot harder to spot. Silent reflux happens when stomach contents come back up into the esophagus but don't make it all the way out of the mouth. So instead of spit up, your baby might grimace, arch their back, gulp repeatedly, get the hiccups a lot, or cry shortly after feeds. It can look a lot like general fussiness, unless you know what you're watching for. So what causes reflux? It's mostly due to an immature valve between the stomach and the esophagus. That valve is still developing and may not close tightly yet, especially when your baby lies flat. Luckily, there are a few things that can make a big difference. First, position your baby more upright during and after feedings. A gentle incline can help gravity keep the milk where it belongs. Try holding them upright on your chest for 20 to 30 minutes after each feed before laying them down. Second, feed smaller amounts more frequently. Big, full feedings can overwhelm their tiny stomach, especially if they're gulping air at the same time. If your baby is formula fed, talk to your pediatrician about possibly switching to a formula designed for reflux. Some are thicker and easier to keep down. And don't panic. Most babies outgrow reflux by 6 to 12 months as their muscles mature. But if your baby is refusing to eat, not gaining weight, or seems to be in real pain, definitely check in with your pediatrician. There are gentle medications that can help when needed. The most important thing to remember: you're not doing anything wrong. Reflux is messy, yes, but it's manageable, and you're doing a great job. If you're counting poopy diapers and wondering if your baby is too backed up, let's talk about constipation, because this one is trickier than it seems. Most parents assume that constipation means not pooping every day, but the real signs to watch for are the texture and the effort, not just the timing. A baby can go 2 or even 3 days without a bowel movement and still be totally normal, especially if they're breastfed. But if your baby is straining, crying while pooping, or passing small, hard, pellet-like stools, that's likely constipation. You might also notice a hard belly, extra fussiness, or even small streaks of blood from tiny tears due to straining. It's heartbreaking, but it can be fixed. So what helps? If your baby is under 6 months and only on breast milk or formula, you'll want to talk to your pediatrician before trying anything. But sometimes small changes to you, the breastfeeding parent's diet, can make a difference. For older babies, starting solids, adding fiber-rich purees like prunes, pears, or peas can help. Avoid bananas, rice cereal, and too much dairy for now. They tend to bind things up. Hydration is key too. If your baby is old enough for sips of water, that can support digestion and ease things along. And don't forget about movement, gentle tummy massages, and those bicycle leg exercises again. They work wonders here too. What's most important is patience. Constipation can be uncomfortable, but with a few tweaks, most babies find relief quickly. If it becomes chronic or severe, your pediatrician can guide you through more targeted solutions. Now let's talk about colic, one of the most confusing and emotionally exhausting things new parents face. It starts the same way for so many families. Your baby is fine all day, and then like clockwork, evening hits and the crying begins. It's loud, intense, and seems to go on forever. You try everything: feeding, burping, rocking, walking, white noise, even bouncing on a yoga ball at 11 p.m. Nothing works. Colic is typically defined as crying for more than 3 hours a day, more than 3 days a week, for at least 3 weeks in an otherwise healthy baby. It usually peaks at 6 to 8 weeks and improves by 3 or 4 months. The truth? We don't know exactly why it happens. It could be related to gas, overstimulation, or just the baby's immature nervous system reacting to the world around them. But here's the part most parents need to hear. Colic is not your fault. You're not spoiling your baby, you're not missing anything, you're not failing. So what can help? Soothing techniques like skin-to-skin contact, swaddling, shushing sounds, gentle rocking, and motion like walks or drives can sometimes help babies settle. Keeping the environment calm and dimly lit in the evenings can reduce overstimulation. But sometimes they just need to cry it out, safely in your arms or even in their crib for a few minutes if you need a break. And please, take the break. Step outside. Text a friend. Ask for help. Colic is hard and you don't have to power through it alone. It gets better. Truly. And your baby? They will likely come out of it just fine. So will you. Here's something that flies under the radar for a lot of breastfeeding moms. Lactose overload, sometimes called foremilk hindmilk imbalance. If your baby is super gassy, has green frothy poops, and seems hungry all the time but never truly satisfied, it might not be reflux or gas alone. It could be an imbalance in the types of milk they're getting. Let me explain. When you breastfeed, your milk naturally comes in 2 stages, foremilk and hindmilk. Foremilk is the initial milk at the beginning of a feed. It's thinner and packed with lactose. Hindmilk comes later in the feeding, and it's richer, creamier, and full of the fats that help babies feel full and grow. The problem happens when a baby gets too much foremilk and not enough hindmilk. It's not harmful, but it can lead to digestive upset, like gas, explosive green stools, fussiness, and constant feeding cues. So what causes it? Often, it happens when moms switch sides too quickly. Your baby might nurse on the left breast for a few minutes, then switch to the right before fully emptying the first. So they get lots of foremilk on both sides, but never make it to the hindmilk. And here's the part most parents miss. Your milk supply might look fine. Your baby might be gaining weight, but they're still uncomfortable. The fix can be surprisingly simple. Let your baby fully drain one breast before offering the other. Don't time it. Just let them lead the feed and keep an eye on those diapers. Within a few days, you may notice less gassiness, more yellow stools, and a happier, calmer baby. And if you're pumping and bottle feeding, make sure you're mixing the milk well so they get the fat-rich hind milk too. This isn't about producing more, it's about balance. And once that balance is back, things can turn around quickly. Now let's talk about something a little more complicated, food sensitivities, especially when you're breastfeeding. A lot of new parents are surprised to learn that what you eat can sometimes affect your baby. and in some cases, it can trigger digestive issues. So how do you know if it's a food sensitivity? You might notice symptoms like mucus or even small traces of blood in your baby's stool, skin rashes, eczema flare-ups, excessive gas, or unexplained fussiness, especially after feeding. The two most common culprits: cow's milk protein and soy. These proteins can pass through your breast milk and cause irritation in sensitive babies. But here's the tricky part: it's not always immediate. Sometimes the reaction builds slowly, which makes it hard to connect the dots. If you suspect a sensitivity, start by tracking your own diet. Keep a food journal, write down what you eat and how your baby reacts. If you start to notice a pattern, try eliminating that food group from your diet for at least 2 weeks. And heads up, if you're removing dairy, you need to check labels carefully. Dairy hides in a lot of foods under names like casein, whey, or lactalbumin. If your baby is formula-fed and showing signs of discomfort, there are gentle formulas designed for babies with sensitivities, like hydrolyzed formulas, where the proteins are broken down for easier digestion. Always talk to your pediatrician before making the switch. And here's something important to remember: food sensitivities are not the same as allergies. Most babies will outgrow these sensitivities by age 1. This isn't forever. And you're not causing this. You're not failing. You're noticing, adjusting, and doing everything you can to help your baby thrive. Okay, let's talk about diarrhea, because it's one of the messiest and most alarming digestive issues for new parents. Now here's where it gets confusing. For newborns, especially those who are breastfed, runny poop is normal. It's often yellow, loose, and may even look like it has little seeds in it. That's not diarrhea. True diarrhea is usually marked by a sudden change. The poop becomes watery, the frequency increases, and it may have an unusually bad odor. If your baby is also vomiting or has a fever, you're probably dealing with a virus or stomach bug. The biggest concern with diarrhea isn't the mess, it's dehydration. So how do you know if your baby is dehydrated? Look for signs like fewer wet diapers than usual, a dry mouth or lips, no tears when crying, sunken eyes or a sunken soft spot, extra sleepiness or lethargy. If you notice any of these signs, don't wait. Call your pediatrician right away. For babies under 6 months, breast milk or formula should still be the only fluids they get unless your doctor says otherwise. You can offer more frequent feeds to help replace lost fluids. For babies over 6 months, your pediatrician may recommend small sips of oral electrolyte solutions like Pedialyte to maintain hydration. What causes it? It could be a virus, a reaction to antibiotics, or even something they picked up from putting their hands in their mouth, which, let's face it, is constant. Here's the good news: most diarrhea in babies is short-lived. If your baby stays hydrated and their energy levels stay up, it usually clears up on its own in a couple of days. The not-so-fun part? You'll be doing a lot of laundry. Just keep those wipes handy, change diapers frequently, and use a good barrier cream to protect their skin. Now, there's a long-standing debate on this one, but many parents and even pediatricians agree that teething can affect digestion. No, teething doesn't directly cause diarrhea or fevers, but it can contribute to digestive changes in subtle ways. When babies are teething, they drool like fountains. That excess saliva often gets swallowed, which can lead to looser stools. On top of that, they're putting everything in their mouths: rattles, hands, your phone, the dog's tail, meaning they're being exposed to a whole new world of germs and bacteria. That can upset their stomach too. So, while teething may not cause full-blown diarrhea, it can result in slightly looser or more frequent poops, a bit more gas or fussiness, occasional diaper rash from the increased acidity in their stools. If your baby is still feeding well, sleeping fairly normally, and acting like themselves outside of a little extra clinginess, they're likely just dealing with typical teething-related changes. What helps? Keep up with diaper changes and apply a strong diaper cream to prevent rashes. Offer safe teething toys, cold washcloths, or chilled silicone teethers to ease gum discomfort. If you're unsure whether it's teething or something more serious, pay attention to what else is going on. A sudden high fever, vomiting, or signs of dehydration aren't typical for teething. Those require a call to your doctor. But for that mild tummy upset that comes with every new tooth, it's just a part of the journey, and you're likely doing everything right. Digestive issues can feel overwhelming when you're in the thick of them, but once you know what to look for and how to respond, everything gets a little easier. If you want to make this journey smoother, check out the links in the description. I've gathered some trusted baby essentials, helpful guides, and parent-approved tools to support you and your little one every step of the way. And if you found this helpful, be sure to subscribe for more practical parenting tips, real advice, and encouragement. Because you've got this, and you're not alone. I'll see you in the next one.